So fascia is connective tissue that is a spider webby stuff that connects our entire body. It surrounds our muscles. It connects muscles to bones. It's everywhere. Now, with that being said, fascia has been one of the most understudied, underappreciated structures in our body. And early in the connective tissue world, people that would have widespread soft tissue dysfunctions were diagnosed with fibromyalgia. Now, fibromyalgia, when taught classically, is always compared to myofascial pain syndrome. Fibromyalgia has tender points. Myofascial pain syndrome has trigger points, which means a hyper-irritable muscle fascicle when you palpate it, sends radiating pain, and can elicit a twitch response. Fibromyalgia, it will just hurt when you push on it. And there are ratings and systems to diagnose both. However, when you look at fibromyalgia, it is more often women than men. It is women that have had certain things happen to them. And I personally believe it is a central sensitization of your nervous system. So your hypothalamic pituitary axis is off. Your sleep is off. You don't get deep, restful sleep. Now, there are many reasons people could probably have fibromyalgia if we're going to use fibromyalgia as a blanket term. I personally believe a majority of the patients I have ever seen that came in with an official diagnosis of fibromyalgia have an undiagnosed connective tissue disorder. And when you look at a body map that shows people that have tender points in fibromyalgia, it is always at places that I call junctions, meaning the bend of your elbow, the nape of your neck, where body parts transition, curves, or from a shoulder to the trunk. In these parts that are junctions, those, let's say your shoulder is attached to your body through your connective tissue, your capsule. If you have EDS, which is a connective tissue disorder, that joint capsule will be lax and flexible on both sides. So as your body tries to keep it together, it is not crazy to think that it can be tender because your muscles and fascia and everything is doing what it can to keep it together. So then widespread joint pain can happen because your body is not necessarily being the most efficient. Fibromyalgia is real, but I think there are other things that play into it. Myalgia is widespread pain within your muscles, your fascia. You can get myalgia if you have the flu, if you have COVID. Fibromyalgia was what we have diagnosed people with widespread joint pain, and there isn't a blood test, there isn't a genetic test. It is diagnosed by a doctor using various criteria, but I think with time we will see that fibromyalgia will go away and connective tissue disorders will be diagnosed more and more often. To be diagnosed with a connective tissue disorder officially, you have to see a geneticist or a rheumatologist. Now, I am a physical therapist. I have I have a keen sense on who has connective tissue disorders, but I still, once I think somebody has it, I will refer them to the geneticist or rheumatologist because we work as a team to take care of all people. I believe fibromyalgia is real, but I believe the reasons people can have it can be varied and that connective tissue and women's health have been understudied for years. Myofascial pain syndrome is very different and can happen equally in men and women. Fascia applies to all of this, and fascia is the connective tissue spider web material that surrounds the muscles. Your fascia can be affected by your hormones. Your fascia can be affected by your cycle. Your fascia can be affected by your hydration level, your nutrients, a gazillion things. Hope this helps. I'll do more. Hit the plus sign and follow along.